Vidu, I'm audible?
Yes, sir. We can hear you, sir.
And slide is clear also.
Yes, sir. You can
Can I
go ahead,
start?
sir.
Is the YouTube
Yes.
live on?
Yes, sir. We have done that.
Okay. So good evening once again to online dentistry. And just amazing the support shown by you all towards our programs. We have a lineup of program coming up in 2026. I will tell you at the end of the class about the lineup of programs coming up in 2026. So I'm going to start with today's topic. So Zia Chishti. Zia Chishti is a Pakistani guy settled in America, mother from Pakistan, software engineer. He was a student in Stanford University. He had to undergo orthodontics and he felt orthodontics as kind of horrible. He went back to Stanford University and he decided something has to be done. This is not the way to move teeth. We should help the dental fraternity. He worked on it, researched on it, and he is the founder of this concept called as clear aligner. It's not even a dentist, please understand that. He started his company, which is none other than Align Technology, one of the most famous clear aligner companies. Forbes magazine has told his net worth when he was just 29, listed him as America's top 50 bachelors. That is the range at which he got the whole clear aligner system or the Invisalign system into the whole world. Now, this class of today is not regarding clear aligner per se, which we have already done multiple times. We can send you the recordings and all that later. Today's class, by popular demand, so many people ask for specific stuff in clear aligner, of which today we're going to talk about attachments. There is going to be a separate class on IPRs. There's going to be a separate class on software management. So because it's a huge topic and we can't do the whole thing in one session. So today I'm going to cover just that attachment part related to clear aligners. Now, those who are doing clear aligners will definitely know what are attachments. I'm sure they are definitely using attachments. Without attachments, I don't think any company these days is going to allow you to put these plastic trays. Attachment has become the part and parcel of clear aligner technology. Now, these small little tiny buttons or attachments changes the way you move teeth. So, first question, are they really needed? The answer to this is a big, big yes, it is needed. Attachments are needed. But these days, some labs are telling to put attachments almost all teeth. That is not exactly the way to go. I will talk a little bit later about that. So, are attachments needed? Yes. Now, what are the uses of attachments? Attachments are divided into two types, retention attachment and active attachment. Retention attachments are for the retention of your tray. Just to make sure your tray stays there, that's a retention attachment. While active attachments are attachments used for controlling tooth movement. So, retention attachments are normally placed on molars, second molar, first molar, maybe even premolar as the retentive attachment. While active attachments are placed on front teeth, the canines, that is rotated centrals, rotated laterals, depends on the condition. They will ask you to put attachments here and there. So there are two types of attachments, retention attachment and active attachment. So retention attachments, as I told you, is purely for the retention of your tray. especially in short clinical crown cases. This tray may not even fit there, it will just come off if there are no attachments. Look at this video wherein you have an attachment, and look at this on the right side, you can see the tray going in. It's a snap fit. I'll put the video once more. It's a snap fit there. That makes sure the tray stays there. So these are retention attachments. Now coming to active attachments. Active attachments are for active movement of the teeth. So depending upon what type of movement you're planning to do, there are different types of active attachment. I do not want to go into the details of each type of attachment and the shapes and all that, because the lab guys or the software will automatically detect all that. And now it's AI generated detections happening. It will tell you exactly for this kind of movement, what kind of attachment is better will be now told by AI. So there is no point in me taking an elaborate class on the different types. But why is it placed? You should know that. Look at this particular case of two central incisors, two central and the lateral incisors slanting. The typical scenarios you see on a relapse case. How many 40-year-old, 45-year-olds are coming to you saying that I had done orthodontics when I was young and now it's all changed. I would like to get it recorrected. And recorrections, it's so easy with clear aligner. There is no reason to put the whole braces once more. So looking at those two central incisors, if you look at that, if you want to create space and make the tooth parallel so you can put an implant between, you need to have these kind of attachments. Look at the attachment and look at the forces acting on upper part of the attachment and the lower part of the attachment. That kind of precise movement is possible with the so-called attachments. So, one second. Sorry about that. I got my screen. Yeah. So, that kind of precise movement is what is achieved with these attachments. Now look at this case where there is a central incisor, lateral and central incisor, which is like too much intruded. Now you want to extrude it. You got to have an attachment on that teeth, and you put the tray in slowly. Each tray by tray, you can see it slowly extruding. That is using these attachments. So those pinpoint composite buttons are really useful when it comes to precise movements. And look at this intrusion that is needed. Now, on the intrusion case, if you really look at it, there is no attachment on the teeth to be intruded, but there are so many attachments on the teeth next to it. So that remain as anchorage to bring the teeth down. In conventional orthodontics also, you put a bracket, you put a wire, goes like this. That actually the other teeth actually do not remain as an anchorage. There is a reciprocal thing. When this intrudes, other extrudes. Every action has an equal and opposite reaction. That doesn't happen here because the software, the tray is set in such a way that the tray will make sure only that central goes down. So this is not exactly the example to tell about anchorage control, but what I want to tell you is for bicuspid extraction retraction cases using clear aligner, anchorage losses is zero when it comes to clear aligner, because there is no movement, there's no mesial movement incorporated onto the tray. Then how will the molar move forward? Unlike conventional straightwire ortho, it is so difficult to make sure the molars doesn't come forward on your 4 bicuspid extraction retraction cases. So as I told you, attachment, there are different types: horizontal for intrusions, for extrusions, there are different types. For rotation, there are rotational attachments available. These are different types of active attachments I'm talking about. Look at this. You need to get the tilt correct for this particular teeth. You can put two attachments on a teeth. In straightwire, you can't put two brackets like that. You get much better control over tooth movement with your clear aligner technology. No wonder clear aligner technology is taking orthodontics into a different level altogether. So it's going to rotate it with the two attachments in there. The biomechanics is pretty much similar to your conventional straightware, but but the control over tooth movement is far, far better. Now, another condition where you have to see is the torque controlling, that angulation of each teeth. Every teeth has to have an angulation, central incisor, lateral incisor, canine, the torquing. So if it is under torqued, you want to get it torqued, you have to use an attachment on the incisal edge, sorry, cervical edge area. Look at my mouse, you can see on the cervical edge area. So the pressure will be placed on to this area, so the teeth gets a proclination, a torquing, especially class 2 div 2 cases where your lower upper central incisors need an outward torquing. You need buttons of this kind. So just wanted to go through a little bit of uses of attachments. I covered about retentive attachment and active attachment. This is the torque controlling is same as your straightware, giving the correct torque to the teeth. If you put rectangular wires on your straightware, you get the correct torque. Same thing is achieved with brackets, with composite buttons and clear liner technology. Now coming to how are these attachments placed. So attachments are needed, bottom line, and there are two types, retention attachment and active attachment. Active attachments are for active movements. Now, how do you place it? Lab is going to give you button mold. Those are molds which has those bulges in it or those depressions in it. So you got to fill the inside with composite, and I'll show you a video soon. What I want to cover here is many labs give different types of button molds. It's an evolving field, a lot of research going on. Companies change their methodologies once in a while. For example, when I started, many companies were giving sectional molds, like for a central canine, central lateral canine, one section, other side central lateral canine, another section, molar, premolar, another section. Now, many companies are giving a single tray with all the attachments together in it rather than sectional attachments. So that is a company to company difference. Another major difference you have seen is the material used. Many companies are moving towards flexible trays for placing of the button rather than the rigid ones. The rigid ones, once you place it and when you want to take it out, it's a little difficult. So they give the flexible ones which can just literally peel it out kind of effect. So type of tray, type of button mold attachments given by the lab can be different, and the material used can be different. Now, which is best? There's nothing like that. I would say all companies, including Invisalign, is moving towards full arch, not sectionals are almost going off, according to my knowledge from the multiple labs which I am doing. And flexible materials are used by almost all companies. So that part is clear there. Now you have to keep your teeth ready for this, and you guys do composite. I don't want to waste time on etching, washing, drying the teeth and all that. So you got to put a cheek retractor, etch it, dry it, apply the primer, and now you are ready for putting the composite. Let's now look at placing the composite. Now, flowable composite is the ideal methodology to place buttons. So you take flowable composite and fill it inside the holes. And you can do full mouth in single shot. Actually, if it's flowable composite, it's not that difficult at all. But in case you are a beginner, I suggest go for one side of the arch. One side, fill it, put it, and cure it, and then come to the other side. But once you're experienced, you can do it in single shot. It comes as a single arch anyways. And then you place it inside the mouth, and then you're ready for light curing. After light curing, just take it out. You are done. You just have to clean up the excess composites there and then. Instead of flowable, okay, let's see a video here. This is an animated video from the YouTube, but this is pretty informative. Just go through this video, see what are they doing here. No rocket science. They're just showing the complete etching first. Yeah. See, they are etching on canines now. So this particular case, canine is required for placement. And after drying, you put primer. You put primer. Like cure the primer, just like how you do a composite filling. Yeah, now look at this. With floor composite, they're filling the inner part of those buttons. And now place it in. And like here. That's it. You're actually done with your button plate. Remove it. Your buttons are done. Just check carefully for any excessive composites here and there. Clean it up with a composite polishing burr. If there is too much of excess, keep it clean and nice. You are done. Another methodology is using packable composite. I used to do packable composites. Packable composite problem is a little time consuming. You might have to have your assistant packing it for you when you're doing the primer and the light curing. Otherwise, it's going to take a lot of time. You packing each hold, it's going to take a lot of time. Yeah, you take composite with your filling instrument and pack it inside. Fill the button slot completely. Another issue which I've seen with this packable is when you place it in, there can be some areas where you haven't packed it fully. So the composite is not touching the teeth in some areas at least. Now that button is going to come off. That issue I haven't seen in flowable because anyways, when you press it in, there will be a little bit of extra flowing there. So everything will touch onto the teeth. One methodology to solve that is after packing with a packable composite, pack completely and nicely, then take a little amount of composite and place it over it. So there's an excess. And now you press it in, put it in, it has a better attachment to the teeth. So now let's see a video of doing packable composite. So this is packable composite, filled it in here. Okay. And another one thing I want to show here is, okay, after etching, bonding and all that, let's finish all that part. Okay, now they're applying the primer. Light curing. Now, when they keep this tray, look at that, the packed tray is kept. They are using an instrument now. They are using an instrument to hold on. Look at that, that instrument is pressing the button. Look at that, instrument is pressing the button a little and then light curing. That way, you make sure that it is getting attached to the teeth nicely. Then just give the first tray to the patient. You're done. So in that visit, you can place all the buttons and you can deliver the first tray. Normally, all labs give like that, button mold and the first tray. And once you give approval for the first tray fitting nicely, they make the remaining trays. Some companies do other way around. You put the buttons and then give one more scan and then they give the first tray. These are small lab to lab changes here and there. You got to discuss with your particular lab to find out how they are giving the button molds and the trays. So this is the button molds in place and the buttons in place and the first tray in place. Now I want to conclude with few tips regarding this while placing buttons. Number one, try to use a black gloves. The black nitrile gloves are available. Try to use a black nitrile glove because these gloves give a nice contrast. Nice contrast when you hold it. Otherwise, the all looks white and you don't know where exactly is the button. You don't know whether you have filled the composite nicely. So a black thing gives a nice contrast. So you try to use that. Then another thing is this clickable composite. Yeah, this is amazing stuff from Ivoclar. You should try to get that. This saves a lot of your time. No brush, nothing required. Just clickable composite. That is one good tool you can buy. Now, this is the specific instrument available to hold onto the button while light curing. But I don't think you should really invest on an instrument like that. What I use is the old, the silver amalgam. We had something called as a condenser. So we use that for holding, just a hold and light cure. There are now the buttons and attachments have become so popular that companies are coming out with button holding instruments and all that. Not a requirement, I would say. Another thing, a few issues which we notice with the button is the stains around the button. So that you might have to do a little bit of scaling and a repolishing, or if it's really bad, you might have to remove the button and put a new button. So staining is pretty common, okay? That is something to do with the hygiene of the patient also, but it is pretty common. So you got to be prepared for that. Now, removal of the button. Once you are done, once the treatment is done, you got to remove it, right? To put the retainer. Now, removal is actually a little tough compared to the conventional orthodontic bracket removal. Bracket, just one nick, it comes off. This won't come off like that. So here you'll have to use composite polishing. You can use a bracket remover and try to scratch a little, it'll come off in one piece sometimes, but otherwise you have to use composite polishing bar. Use composite polishing burr very slowly and carefully. Do not lose too much of enamel because of this. So the whole concept of clear aligner advantage is no bracket placement. Now there is button placement, which is like almost on all teeth sometimes. So it's a like bracket placement. So when you remove it, there are high chances of loss of enamel. At least microscopically, you are losing enamel when you remove the composite. So be very careful, slow. The textbook says painting stroke for removing the composite, not like this with your composite polishing bar, painting stroke. So check out all that part on the removal. Read more. I can send you a number of articles regarding all this. So that's about the removal. And then I had chat with all my international friends as well as my professors in New York University and all that as part of preparation for this lecture. And everybody in the US said, Doctor, you just talk to my assistant. She's going to help you out on this. So because in America, it's the assistant doing all this button placement, button removal, and all that. So I had a good chance to talk with the assistants. I had an invitation to listen to one of the webinars by the dental assistants in US. Dental Assistants Association, I was invited once so I could listen to their issues, their problems they are facing on removal of the thing and all. And one interesting thing I noticed by one of the lady, she said she uses this small ultraviolet. It's available in Amazon, 300 rupees, ultraviolet UV kind of bluish light. They put the light onto the teeth. It will clearly show there is more composite there or not. So you can use our light cure also, but I'm talking about assistants. So they have their keychain. They just click and light it and see whether there are remaining composites there. So it's a nice tool. I also got one and found it very useful sometimes. I mean, very handy. It can be in your. I keep it along with the IPR gauge, which comes like in a keychain. Same way, this also kept around there. So that's a useful tool I found. So, guys, that's it. That's all. It's a very small session I wanted today. This is to summarize what are attachments, what are the types of attachments, and how do you place it. Summary again, attachments are needed, no doubt about it. Okay. Now, thank you very much for coming in. Quickly, I will take a few questions if there are any. I just need 2 more minutes to just explain the coming up programs of online dentistry. As I told you in the beginning, there's a huge lineup of program coming by online dentistry. The biggest thing coming up is the aligners in mixed dentition. Clear aligner is taking over to pediatric dentistry. So mixed dentition, the 2x4s and the utility arch purposes are all getting slowly going off, with clear liner taking over that also. But that needs a little bit of learning on the biomechanics and all that. So myself and Dr. Joby together, we are doing aligners in mixed dentition. Classes coming up, immediate classes, Jan 12th in Mangalore. Yanapoya Dental College is organizing it. And Jan 18th, here in Kochi, in Muatupura, there is another program, all sponsored by one of the finest labs in the country, MaxDent Ortho, which has a pedo first concept now, purely for pediatric dentists. Now, both the programs are almost batch full, 1 or 2 seats remaining. That's also, this is almost closed here. More classes coming up on mixed dentition soon. We will announce all that in our groups. Those who are not in any of our groups, please let us know personally. I'll put my number at the end. Please come to me personally in WhatsApp. I will add you to one of our groups so you can get notified on the programs we are hosting. Another big thing we are looking forward to is the huge graduation ceremony happening in Malaysia. This is part of our 1 year fellowship program. This batch is graduating in another 10 days' time. So we are all going to Malaysia, almost 50 of us going to Malaysia for this graduation ceremony, Jan 22 and 23. That's a big thing coming up. Then online, we are planning to continue our online sessions. So we got one of the finest endodontists, Dr. George Jacob, who is going to simplify endodontics for you. He's such a famous guy when it comes to endodontics and when it comes to making things simple. So his online program is something to watch for. That is February 4th. It's coming. That's another Wednesday. First Wednesday of every month, there will be a free online webinar program like this, which of course you will get a certificate of participation also, those who are interested in the certificate part. Then of course our main flagship program, the program, the in-demand program, that is the 3-day myofunctional program. 3-day extensive, intensive training happening, 3 days offline in Kochi, in Alua. That's where we are based. I am based. So it's very near to my clinic in Alua. 3 full-day program. Starts at almost 8:30 a.m. Goes till 8:30 p.m. That hectic it is. Though it is hectic, it is not boring because it's all hands-on. You do complete early age orthodontic correction, class 1, class 2, class 3, complete cephalometric analysis, model analysis, photograph analysis, and multiple appliances like the twin blocks, FRs, 2x4s. Everything will be covered, and biggest thing is that we have incorporated ENT into it, giving the candidates an idea about the role of adenoids and tonsils in mouth breathing, how to tackle mouth breathing. Everything will be covered in the 3-day program. After you attend the 3-day program, you will not send a pediatric case away saying that please come at the age of 12, 13. At that time, I will put braces for your kid. No, you won't do that anymore once you attend a program of this kind. So that's a 3-day Myo program. So that's it, guys. This is my personal number. You can WhatsApp me in case you're not in any of our groups. Please let us know. We will add you so that you'll get notified on the programs coming up. And this is our my Insta page and the Facebook page. So feel free to keep in touch. Feel free to comment. Come to me personally in the WhatsApp and let me know how you like the class, how we can improve the class. Please give us suggestions on the topics you would like to hear through online dentistry. So we have resource person for almost every topic. So we need your suggestions and feedbacks. That's it. Thank you very much. Can I take up some questions? Are there any questions? Please, you can unmute yourself and ask. I guess nobody is in a mood.
Sir? Yeah, good evening, sir.
Good evening. Sorry, I came in late, so I hope I'm not asking a question that was covered. I just wanted to find out in terms of when using attachments. I've had an experience once before, and I've heard other people as well, that sometimes when you're doing the attachments, they sort of all come off. Even though, like, I'm quite meticulous, I've used I've polished the teeth before doing it. I use acid the right amount of time and the correct bonding procedure. Um, and the way I sort of recovered was by basically cutting the template into like 2 or 3 pieces in order to get them to stick permanently, and then they generally don't come off after that. What would you suggest is the best way of doing them?
Okay, so your question is what to do if it comes off, is your question, or what to do to prevent coming off?
Well, what to do to prevent them? Like, what is your procedure to
Yeah, to prevent coming off, I think I already told you, fill enough composite, let it be little excess composite, let there be little excess. And then once you place the tray, hold on to the button using some instrument or your finger, or many times I even use the same light cure tip touching the button, just a push towards the teeth that will make sure that the whole surface is attached to the teeth instead of some voids here and there. That will make
right?
sure that will prevent it from coming off. Even after doing all that, still if the so now can I go to the second part of the question? What happens if it comes off, right?
Sure.
Yeah.
Yes, yes.
So if it comes off, you will have to refix it. But the problem with refixing is if you are like, it depends upon when it is coming off. If it's coming off next day, you are fine. You just have to call the patient and use the same template and put another button, you are done. But
Yes.
what if it comes off after 3 months of movement? Then that template won't even fit it.
Sure.
So you many times what I have done is whichever tray they are using, use that
Yes,
tray, put little bit of Vaseline inside that particular button. We are talking about 1 or 2 buttons, right? Not the whole thing. So put little bit
sure.
of Vaseline and use that tray as a button mold for that particular tooth which lost the button. Did that
Yeah,
did that answer that question, or is it clear or confusing?
sure. Yeah. No, I've never had a problem once they've bonded on, but my problem only happened once, but I've heard other people having a similar problem. Um, and there was a discussion on whether you cut the tray or keep it whole as it is when you
Now, which tray are we talking about? The original button mold?
yes, for the
Yeah,
template for
see,
the
if
attachments.
so, this is after 3. Let's assume that you lost one particular button of the central incisor after 3 months of movement. Okay.
Yes.
Now you want to put that particular central incisor button.
No, well, that hasn't happened. So I would then just use the actual aligner that the patient is using.
Yes, that is the way
I'm
to
talking
go.
right in the beginning, like the first day when you're putting your attachments on.
Huh.
Um, yeah, like either they all come off or most of them come off, and then you've got to redo them.
Okay, now to answer that again, I have to ask you another question. What kind of a button mold are you using? Is it a flexible material or a rigid material?
Um, as far as I'm aware, it's a rigid material that has slightly less
Thickness.
rigidity to the aligner.
Got it. But I suggest use a flexible material. Many companies are now giving flexible materials.
Yes.
So if you are using a rigid material, of course, it is not as rigid as the original tray. I know it is much thinner.
Yes. Yes.
Still, it is little too much of force to take it out. You have to like literally take it out like this. You got to peel it out. You understand what I mean? An outward
Sure.
movement. For that
Yes.
outward movement, flexibles are definitely better. Otherwise, like you said, make it into small sections, individual teeth, which is a hassle. Which is a hassle doing it, but that is another way to go.
Okay.
I
And then
think adding little excess composite will solve your problem completely. Try that first.
Okay. And then do you prefer a flowable composite or a normal composite?
I prefer flowable composite because I have found flowable composite flows in nicely and little excess. I can see that little excess and place it in, it attaches nicely. Packable, our packing may not be correct many areas. There can be small underpacked areas here and there, which won't touch the enamel. And then eventually it comes off.
And then do you have a preference of flowable to use?
No, any conventional composite which you use for your fillings, not the orthodontic composite, yeah, not the bracketing composite. Any conventional composites will take care of it. I am using the
Sure.
3M and even Ivoclar. I am using multiple companies here for my
Yes.
conventional fillings. That's it. That's it.
Yeah. Because I think Voca has a very good one
Yes.
that's sort of dedicated to like aligners, attachments.
Okay, that I am not aware of that. I would like to know more about it. I would like to know why is it dedicated to, I mean, why do they claim it dedicated to aligners? Because of the compressive strength or anything? I would like to know the MPa, the
Yeah,
megapascal they are using for that then.
yeah. There's a reason. There's some reason to it. I think it's also it might have some properties that when you shine a light on will show up the resin as well. You know, like so
Ah,
when you're removing it.
that is while
I
removing, yeah.
can't remember
Got
the
it.
details. Yeah,
Got it.
I
Got
think
it.
it might be something like that. But what I have got, I know I've got a brochure on it. I'll have a look at it and maybe take one or two screenshots and send it to you.
Sure. Please do keep. Where are you from, sir?
I'm from Johannesburg. I'm in Sandton.
Yes, yeah. You have attended many of our programs. I remember you coming in.
Yes, yes.
All
It
right.
was about during COVID. I
During
was
COVID,
there
yeah.
regularly.
Yeah.
Yes, yes.
All right. So thank you so much
Okay.
and keep in touch. My WhatsApp number is there. You can WhatsApp me
Sure.
anytime. Yeah.
Sure. Thank you very
All
much.
right.
I
Thank you
really
very much.
appreciate
Dr.
it. Right.
Zasleen, sorry for keeping you waiting.
No problem at all. No
All
problem.
right. Thank you
Thank
so
you.
much, sir. Thank you so much. Yeah.
No, sir,
Go
no
well.
worries. It was same. It was the same doubt. My
Oh,
doubt was
okay.
actually if the attachment comes out, then how do you go about it? That
Yeah.
is like
That is
after
covered.
it's a few aligners down,
Yeah,
then
that's
how do you
what. Well, my issue, what I have faced is when the attachment comes off after few months of treatment. Initial coming out is not a problem, but after few months of treatment, if the attachment comes off, it is not good news. So what I normally do, I told you, is to use that the tray which they are using at that time, use that tray as the button mold. That will solve the problem. Otherwise, you have to take a new scan and tell the lab guys to give a new button mold and all that. But that may not be possible for all the cases because multiple cases are from multiple countries or they are traveling. And the reason why they chose clear aligner is the convenience of not coming and meeting me every month. So it's not very easy to deal with that. But I have used this tray, that particular tray, as the most successful methodology to finish that part off.
And it happens just
It
the way it
happens. It
happened with
has
the
happened to
template.
me. It happens. It has happened to me, and I've solved it with 99% of the times with that particular tray. One or
Okay,
two
so
times I had to send it to the lab again for a new button mold. Another thing is you have to look at which tooth button mold has come off. If it is a molar button mold that has come off, forget it. Yeah. It is just a retentive one anyways. So other side has the retentive one anyways. and the canine has, the central has, so there is retention anyway. So you don't have to really worry about fixing that molar one many times. I'm saying many times because there are 4 bicuspid extraction retraction cases I'm doing with clear aligner. There,
Okay.
the molar are very important. The molar buttons are not just retentive buttons there. They are for anchorage. They are for
Anchorage.
many other distal, little bit of distal moment. There are a lot of things happening there. So depending upon the case, depending upon the stage, you can decide whether you really have to fix it back or not. Many times you ask the lab, they might say, doctor, the what you lost is on the central incisor. That central incisor, it's almost done with its treatment, so don't worry about it. Now the next tray movements are all for the lateral or the canine or whatever. I'm just giving an example.
Okay.
So the software has decided the movement is all over for that particular teeth. There is no reason to put it back again. So that's a call which you have to take by discussing with the lab also on that.
Okay. But once, if you try doing it with the tray, it is not very difficult, right? So if you
It is
have
not
to
very
attach.
difficult. It is not very difficult. Again, depends upon the company. Some companies, the original trays are very, very rigid. I hate that. I don't want to name any company here because this particular program is not sponsored by any company. But I prefer companies that give little thinner trays. There are beautiful thin tray, thicker tray, and the thickest tray concepts are also there. Three
Right.
stage concepts are also there so that the patient also gets used to it so nicely. Day one, you put the complete button and put a very rigid tray in there. They lose complete confidence. They feel, oh my God, I think I lost my 1 lakh rupee or whatever. So take it easy. Like you put an O12 night eye as a first wire in a conventional ortho to get that good feeling for the patient or the kid. Oh, this is nothing, no pain, nothing. I thought the first wire you put will be very painful and all that. So it's just practice management then. Take it easy. Go with a thinner tray, then go towards a thicker tray. That's something which you have to talk with your particular lab which you are doing this.
Okay. Okay. Thank you.
Thank you
sir.
so much for coming in and spending your time. Hope it was productive. Keep in touch. Anybody else? Any other question? It was such a small topic anyway, so all right. I think we should call it a day. Anybody has any question can just
So,
yeah.
not related to this, but so next time, can you do 2x4?
2x4
lecture on
through
2x4,
online.
if possible.
2x4 through online won't reach anywhere. To learn 2x4, you need to know the biomechanics. You need to know the orthodontic. What are brackets? You have to physically touch and see the bracket, and then the wires, and then the movements incorporated onto each bracket, the tips and the torque incorporated. I won't reach anywhere doing that. So, I don't want to do anything that will not reach anywhere. I can just give an intro that I've already done. I think it's already there in our YouTube channel, an intro towards 2x4. That is, why still put finger spring, Z spring at the Holly's Appliance and all that. We have a predictable, guaranteed result available with 2x4s. That's an intro, basically, not the
Okay.
physical how to place bracket, where to place bracket and all. It's not easy to cover online, no?
Okay. Okay, sir.
Okay, good. So can we call it a day? Nobody wants to go, all I hear. There's no dinner. Okay, so thank you once again from the bottom of my heart for spending your time being with online dentistry and the support you guys are giving us. Good night. God bless.
Thank you, sir. Good night.
Good night.